It's important for our roundtable to acknowledge and thank the National Academies of Sciences, Engineering, and Medicine for all of the support they've given, not just to this roundtable, but frankly to obesity-related work over all of the years of this epidemic and our work here in Washington and elsewhere. But today we have the opportunity, and this is an unexpected pleasure for me, to personally thank Dr. Victor Dzau, President of the National Academy of Medicine, who has personally taken an interest in this issue during his leadership here as well as during his career. His interest can be seen in two very dramatically different ways. One, this is Dr. Dzau's coffee table, which he was kind enough to loan us throughout the duration of this meeting, which is an unusual benefit for this roundtable and shows a personal commitment. We do not know how they are having coffee in his offices, but perhaps that question will be answered because he is here today personally to both bring greetings as well as to bring our Surgeon General to the stage. And while he is approaching, I might ask our next panel as well to take their positions. Dr. Dzau.
Well, good morning, and what a pleasure it is for me, first of all, to welcome all of you on behalf of the National Academy of Medicine. And first, let me say that this is a phenomenally important topic, and this roundtable, I believe, is one of the most important ones that we have here at the National Academies. And in that context, I want to thank Bill Purcell, who's just shown great leadership in pulling this initiative forward and organizing this particular meeting. This is actually such an important topic that this year's annual meeting of the National Academy of Medicine is in fact on the topic you see out there, a brochure that says, Exploring the Intersection of Obesity and Type 2 Diabetes. And we have Margaret Chen, the Director General of WHO, to come here as keynote to discuss the global trends, and of course our own Bill Dietz, who's here, and will be also the keynote talk about U.S. trends. So I hope many of you will come to our meeting as well, which is coming up on October the 17th. So now it's my great pleasure, when I think about this topic, you have the dream team, if you will, for the next panel. When I look at Jeff Kaplan, Bill Dietz, of course my good friend David Satcher, and our Surgeon General, Vivek Murthy. What a great group of people. But I do want to say a personal word about Vivek. Vivek is a compassionate physician. He is a man with great integrity. He's a real leader. We're so glad, Vivek, that you are now the Surgeon General. As I said, I knew him when, but I now need to salute him because he's a Vice Admiral. Certainly you know that for the last year and a half, since he's become Surgeon General, he's really been a wonderful leader and traveled the country and elsewhere to try to work with all of us on so many issues on health of the nation, recently certainly on opioid addiction, but of course this topic on obesity is a very important topic to him, and we're so glad that you can join us today, Vivek. So without further ado, let me turn it back to Mr. Purcell, just to thank all of you for being here, and I look forward to hearing this panel discussion. Thank you.